your bad health into good health at any point of time. The first speaker, Balakannan, is a living example of that. His presentation will enlighten you how he transformed himself by changing his mind and concentrating on maintaining the health. I invite the first speaker, Dr. Balakannan from Thuthukudi, to deliver his lecture.
Good morning to all. Thank you, Muthu, for the introduction. So in all conferences and CMEs, we doctors gather together and we talk and share our ideas about improving the well-being of the patient. But we never discuss about improving our own well-being and health. So I thank the organizing committee and the scientific committee for making this session lifestyle for orthopedic science. So there are so many studies pointing towards only one thing: the general health and the lifespan of doctors is low than the general public. So we never care about it. We are stuck in a hamster wheel. காலையில் எந்திக்கிறோம், சாப்பிட்றோம், ஓபி பார்க்குறோம், சாப்பிட்றோம், கேஸ் பண்ணுறோம், சர்ஜரி பண்ணுறோம், again we go and sleep. இந்த சைக்கிளை நிப்பாட்டுறதை பற்றி நம்ம யோசிக்கிறதே கிடையாது. Literally speaking, many of us don't know our current BMI. We don't know we are obese. So as orthopedic surgeons, we see many elderly hip fracture patients. We do surgeries. It's very obvious. The elderly obese people carries many anesthetic risks and very difficult for do surgery, and even very more difficult to go for physiotherapy and rehabilitation. They take weeks to make them walk. But elderly fit patients, less anesthetic risk, and they stand up and walk even after 2 or 3 days. It's very obvious. Imagine we can end up on the other side of the knife also. So what are you going to do if we get an illness? Obesity is not a disease. It's a lifestyle problem, and it can be completely reversed with lifestyle changes and modifications. As the first step, we all know, but they're difficult to follow: stop smoking, stop alcohol. Equally harmful and addictive is sugar. So entire patients, if they are obese, I always advise them to stop coffee and tea. Most of them never turn up again. It is not the addiction to coffee or tea, it is the addiction to the sugar in it. Stop all the sugar containing products, even sauce, soft drinks, biscuits, chocolates, everything contains sugar. So insulin resistance is the basic problem with obesity, metabolic syndrome and diabetes mellitus. What we doctors are trying to do is, we give more insulin, we give drugs to increase the sensitivity of the cells to insulin. But we forget the food part. All the food that have high glycemic index and high glycemic load increases the sugar, obviously, that's carbohydrates. But we continue to take carbohydrates because we are afraid to substitute carbohydrates with fat and proteins. So times have changed. Fat is not an enemy, fat is not a villain. It is a friend and it can be taken. So a good food, good balanced food for a good health contains no sugar, low carb, high protein and includes fat. And next to food, we allocate all our income. We invest in various things for our future wealth. So what are we doing for your future health? Any allocations? No. We can allocate just 4% of our 24-hour day for our health. It is just 1 hour. 1 hour of workout, you sweat it out, your heart rate should increase. Daily 1 hour is enough for our future health. Health illama wealth vich enna seiya porom? So it is either cardio or weight training. Cardio, the simplest cardio is walking, the others are swimming, cycling is very good for the health, and weight training puts you in good shape and health. And doctors நிறைய neglect பண்றது sleep. ஏதாவது சர்ஜரி வருதா, ஏதாவது கமிட்மெண்ட் வருதா, நம்ம தூங்குற நேரத்தில் தான் ஃபிட் பண்ணுறோம். So 7 hours of undisturbed peaceful sleep is necessary for your mental and physical well-being. You cannot reduce your weight without 7 hours sleep. Sleep disturbance, weight குறையவே குறையாது. So the 3 pillars of health are sleep, nutrition and exercise. And these slides are not just taken from the internet for display. This is, I am sharing my life lessons with you. This was 8 years back me. 115 kgs, borderline hypertension, pre-diabetes, hypercholesterolemia and a big L4, L5 disc. This was, I came to 80 kgs after following all the principles I have displayed now. It took me 6 months to come from 115 kgs to 80 kgs. And my wife came from 96 kgs to 60 kgs in 1 year. So weight reduction is not just about looks. It is about health. So I am no boy diabetic, no boy hypertensive, my cholesterol is completely under control and my disc is not paining me anymore. So it gives you a good shape. You get good fairness and glowing face. All the oily skin and your dull look are due to sugar. Stop the sugar, you get fair and lovely. And you can go for your passion in sports. And my passion is running. You get more flexible. These are all the uses of reducing your weight. And you can go for adventure sports, bungee jumping, skydiving. And summa andale we will get many health problems. So if you are going to work out, definitely you will get sports related injuries. So these are all the things I got. But after recovering from all those things, you should again go back to your track. Never lose your track. And at one stage of time, I was not even able to put my foot into the shoes. I cannot fit in the shoes due to foot deformities. I thank Dr. Raja for again putting me on feet and putting me in my running shoes. That was 1 year back. And after surgery, after rehabilitation, I completed my 21 kilometers last week. So obesity is nothing about body shaming or something like that. It is all about your own health and well-being and a long lifespan without any medical problems. So these are all the things. Sugar is poison, no doubt about that. Cut the carbs, pump up the proteins. Fat is not an enemy. Secure 7 hours of undisturbed peaceful sleep. And sweat out 1 hour a day, no matter what. Just imagine the 1 hour as an important surgery. Surgeons never cancel surgeries. So put the 1 hour as a priority, you will be able to allot the time. என்ன சார் ஈஸி டிப்ஸ்னு சொல்லிட்டு எல்லாம் கஷ்டமாக கேட்குறீங்களே. ஸோ இஃப் யூ டூ ஒன் திங் வித் லவ் அண்ட் பேஷன், it becomes easy. If you don't want to do it, even if it is less weight, it will be more difficult. So everything comes to one point, just a simple thing, how bad do you want to do it? If you want to do it, you can find a way. If you don't want to do it, you will find an excuse. Thanks all.
Thank you, Bala. Wonderful presentation. எப்படி இருந்தனா இப்போ இப்படி ஆயிட்டேன்னு அதையும் பாசிட்டிவாக சொல்லலாம். ஸோ it was very wonderful transformation. As we say, learn, unlearn and relearn. So anytime you can retrain our mind, you can retrain our brain to activate. Very, very, very good talk in our position where we are seeing so many sudden deaths and so many cardiac issues. Any questions from the floor?
ஆமாம். So the basic principle is cutting down the carbs and increase the protein and fat. So before going into any diet, consult your physician, get a food, complete checkup, the blood sugar, cholesterol, ECG, everything, and then discuss with your physician and then go for a suitable diet. It is not necessarily paleo. Paleo, keto, எல்லாமே கொஞ்சம் variations தான். So according to your body type, you can go. The principle is cut down the carbs.
Bala, you said the ways how you transformed from 115 kgs to 80 kgs, but you didn't say the secret of how you transformed your hair, whether it is just a dye or shaping your body helps to darken your hair.
இல்ல அது டை தான்.
But another one thing now they are saying sitting is the worst cardiac. So how much every day you walking or even in நம்ம ஓபியில் இருக்கும்போது கூட how much you should walk or அது ஏதாவது மாதிரி பிரின்சிபல் தான் இருக்கா?
இல்ல some professions sitting for a long time is cannot avoid. For example, IT professionals and even doctors, OP non-surgical specialties, you cannot avoid sitting for a long time. But putting that 1 hour into use, you pump up your heart rate, you sweat a lot, that comes into factor.
Sir,
You can compensate for that.
after your weight reduction, your lipids are under control. Are you taking any medicines for dyslipidemia?
No, I am not taking any medicines.
So initially, it
Even
was
with the fat and protein, the lipid profile is completely under control.
so initially you were taking drugs for.
No, they advised me to start on statins, but I didn't take that.
Bala, when you usually advise the patient to go for walking, particularly ladies, they say, வீட்டில் பார்க்குற வேலைக்கே அதே போதும் சார், whether that forms a part of an exercise or you have to do it in this, allot some time to do it, or daily activities will help you in reduction.
No, the active daily life is different and physical activity workout is different. Even if you walk a lot, you have to allot the separate 1 hour for workout. It doesn't count. Because only after 40 minutes of continuous workout, the body starts to burn the adipose tissue and fat. Till the first 30 minutes, only your sugar is getting burnt. So your daily activities, only the sugar gets burnt. Your fats starts burn out only after 30 minutes of burning the sugar continuously. So that is why we talk about 1 hour and 1 hour. It's not 30 minutes. And also all the workouts and walking and running, always start doing that after achieving the ideal BMI with diet. Obese patients, if they walk or if they run or they do workout, they'll get injuries. You cannot do walking with 100 kgs. So try to get to the normal BMI with the diet and then start the workouts.
Thank you, Bala. So activity, avoid lifts, at least use some steps to climb. Each and small things always helps, and it was a wonderful presentation. Thank you, Bala. Thank you.
Thank you.
And we invite now Professor Dr.